So you have to give the instruction to the patient how to collect it. Very clean, just give the very clean instructions. For male, you have to clean the head of penis. How you are going to clean it, they didn't tell it probably, but generally there's a constant always for the male also from center to periphery, wiping head of the penis. For the female, you have to clean the labia. You are not going to wipe up and down. In the area, labia, if you can, you just clean it from the center to periphery again. Never wipe from the back to front for the female. Never. Sometimes like even when you are using the after toilet you are using the tissue paper. Never wipe from back to front. Even you poo after that. You have to go from front to back. Wiping front to back. Why? We have the urethra in front. If you wipe from back to front, the infection from the rectal region can come and cause infection for the UTI. So always for female, you have to clean either just the labia area, you can clean it center to periphery, or you have to clean it by front to back. Better to clean the labia. So then what you after cleaning, you start urinating. In the toilet, you are urinating. If you are in the bed, you are urinating in the bowl to clear the urethra because you are cleaning the outside of the urethral openings. But some infection is still there inside, which is not harmful for us, right? But it is still there. Or if there is something from the outside. So you have to pee a little bit. So when you pee, that has been flushed and go to the toilet or any extra bowels. So that is called you are voiding a little bit and then you are collecting. You can hold the urine and then you can collect in the urine. So how much approximate you have to throughout around 20 to 30 ml you can just pee or a little bit more. It is not easy to so just pee and then collect the urine in the specified sterile container. You can fill it in the cup. You can, if you doesn't have fill, you can half. So there is not too much urine is needed for your culture, but the cup volume is 20 to 30 ml. Then you remove the container from the urine stream without stopping the flow, and then you immediately cap it, wipe it, and bring it to the lab. So this is the sterile if seal is not broken. This is the wipe they just give you to clean the urine and your urethral area. 24-hour urine or timed urine. So timed urine test used to measure daily volume. How much total volume the patient, total volume of urine patient is urinating or peeing to make sure how much is coming out. This is useful to monitor the analytes to monitor kidney function, creatinine, sodium, potassium, urea, nitrogen, protein, if there is any related to the present patient health condition or health problem. Accurate timing is very critical. If any chemical preservative is added, a workplace whemis label may need to be added. let the patient know not to touch it or throw it away. So if from the lab, to preserve the urine, because it is going to go, unnecessary bacteria is going to grow there, right? It's a 24 hours urine. So then you have to put a label for the humus, because you are using some workplace label, right? And from preservative, and that preservative is a chemical. So that you have to place a workplace humus label, and then tell the patient not to touch it or not to take it out, not to throw it out. Patient instruction sheets are giving along with 24-hour urine container. When you are going to deliver this one, there are different types of urine container. So when you are going to give the urine container, you can tell them with there is the instruction sheet. You have to read it and you have to collect it. So 24-hour urine collection. This is the humus label, the preservative, what preservative you have used, what type of test they are asking, patient name, if patient in the room or if you send it in the home, date and time started, date and time completed, and the initials. So patient instruction. Start the collection at a time is convenient for you. If it is 7 a.m., if it is 10 a.m., how is your lifestyle, how is your work style, you can do anything. First, before collection, empty your bladder into the toilet, not in the container. Record time and date of the container label when you emptied it. This is the start time. I am starting it. Then from there, collect all your urine over next 24 hours. You cannot collect the urine in that big bottle. So that's why it's suggested urinate in a separate clean dry container and then pour all urine into your 24 hours container. Keep the container in a cool place, preferable refrigerator. If you miss the collection for even one sample, by chance you went to the toilet and peed, the test must be restarted. Return to the lab for another sample container. If you think you might fill the container before 24-hour collection, you peed so much, the container is filled, you are not going to stop the experiment collection. Ask a second container from the lab and they are going to label it. That is the second container with all the details of the patient and label on the container. So after a final urine sample collected exactly 24 hours after you started your collection, example 8 a.m. So if you emptied your bladder at 7 a.m., maybe you can start collection at 8 or 10 or 9, whatever the time you have started. From there, you have to go to the 24 hours and collect the last urine. Record the time and date on the container. This is the finish time. So 24-hour urine test and preservatives. What type of test? Generally then porphyrins, albumin, catecholamines, creatinine clearance, beryllium, serotonin. So this type of generally things are getting tested in the urine. So if you are adding some preservative, you are going to write the preservative, pre-test preparation, what you are telling the patient. So, and there is as a group, go to the Life Last Test and Service website and look up some 24-hour resistance to fill in this table. Okay, so you have to fill in this table and we can go later. Now, sources of error for timed urine. Loss of specimen in case you miss a simple collection. Inadequate preservative used. So how much it has to be used? That is the proportionate. Wrong preservative used for the test. Specific test is specific preservative. Inclusion of first morning urine. Inaccurate total volume measurement. And transcription error. This you understand. So which of these pre-analytical errors is responsible for the MLT? Can anyone tell me? Anyone or who wants to tell me?
Sources of
Loss of
error for
space.
Hello?
I.
Anyone can tell me?
So you mean what are the sources of error on the
Yeah, for the
MLT's part?
MLT. Yeah.
I would say inaccurate or no instructions to the patient
No, tell me
on
from
how to
here.
collect.
Tell me from this, whatever is written here.
Oh, loss of specimen,
Loss of
inadequate
Yes.
specimen.
Loss of
Yeah.
specimen, ma'am.
Wrong preservative use for
Inadequate
test.
preservative used.
Okay.
Transcription error.
Wrong preservative used.
Okay. More?
Also, I
Inaccurate
did.
total volume of measurement.
Yes.
I would
Good.
include the instructions too. No, because I had to
No,
do
no,
a 24-hour.
no, no, no. That is true. But this is not here. That is true. If you doesn't give the instruction, but I am asking whatever is here from
From
here.
this. Oh,
Yeah. Yeah, because it's just what is showing in your screen. I am asking, try to be specific what you are doing. You cannot tell that. Yeah, without the instruction, you cannot do anything. You have to give the instructions. Otherwise, how the patient will know what to do, right? So then,
yes.
yeah, then special urine collection methods. We have, this is the special one. That is the, you can collect from the urine from your urethra or your genital apparatus. So urethral catheter. The catheter is inserted into the bladder when a patient is confined to bed or cannot urinate independently. In dwelling catheter, obtain specimen using syringe to aspirate from the sampling port at the distal end of the catheter. They put the catheter inside. The catheter will go from the ureter to the sorry, not ureter, from the urethra to the bladder, and then you can collect. Sometimes it directly comes out. Sometimes they put a syringe to collect the sterile urine. The urine, what is inside your body, is sterile, extremely sterile. Suprapubic aspiration. Urine collected using a needle inserted into the bladder through the abdominal one. So a big needle has been inserted on the from your abdomen due to into the bladder to aspirate out the urine. When it does, it's very painful. This is very good for aerobic nitrate culture. When you are going to do that, generally it is not doing very frequently. When a patient cannot be catheterized or a sterile specimen is required. So patient cannot be catheterized. If the patient can catheterize, you can get the sterile urine from the catheter, right? But when the patient cannot be catheterized, but you need to check, especially for the culture or any test, very important urine. So then you have to do the suprapubic aspiration. So collection of urine through a needle, inserting the needle into the bladder through the abdominal wall is called the suprapubic aspiration. Pediatric specimen. A special urine collection bag is attached to the clean skin surrounding the urethral area. So we have a taped kind of adhesive. So you are going to open the bag, clean the area of the kids. This is mainly in the kids, this happen. And then you are going to press that one. So it is going to be leak proof. who has the kids, sometimes maybe you have seen it. And then when they pee, because of you cannot tell when the kids is going to pee, and you can tell, okay, could baby, can you pee it? They cannot understand. So you have to put the bag to collect the urine. Whenever they will pee, urine is, you can see the urine is a transparent, clear kind of polythene bag. So then you can collect the urine. So catheter, suprapubic and pediatric collections. This is the suprapubic. They are going to put the needle here and in the bladder. Then you are going to collect it. This is the catheter. They are going to put the catheter inside the bladder, and then there is a lock so they can collect the urine from here. And pediatric urine collector bags. So you can see the hole. So you can hear this is the adhesive. You are going to take it out and place that one in the urethral area, either male or female, and then the bed kits, and then you are going to collect that one in a bag. Collection and preservation of urine. Specimen must be examined when fresh. That is the highly recommended. Within 30 minutes is the best. Do not test past 2 hours at room temperature if any urine is staying. So you have to see the time of collection and how they have stored it. If it is coming from the collection center to the lab. If it is staying more than 2 hours, never ever test. It's going to give you the false result. If there is a delay in getting into the lab, specimen can be refrigerated up to 6 to 8 hours. Some urine containers, in general not, some urine containers like the 24 hours or some, it says, have a chemical preservative if not able to refrigerate or test immediately. It is not in general used. Always bring the urine back to room temperature prior testing. Even you are keeping it in the refrigerator so that you didn't able to taste it within 2 hours, within the 2 hours time frame. So you put it in the refrigerator, you are going to taste it around 6 hours, 8 hours, whatever. So, but you cannot taste the urine when it's cold. You can take it out from the refrigerator and taste it. Anything in our test, whether it's a blood grouping, any chemical, any solution, anything, you are going to use it, you have to bring to the room temperature. You can preserve it at refrigerator for 260 or sometimes as per the need, the serum or something for long time storage in -18, that is the freezer. But always you have to bring it to the room temperature before the test. So long-standing urine at temperature, what it can cause, what may happens? Growth of bacteria, breakdown of urea to ammonia by bacteria, leading to an increase in pH of the urine may cause the precipitation of calcium and phosphate. So pH is going to be high, there will be growth of bacteria, urine may feel cloudy, oxidation of urobilinogen to urobilin. Destruction of glucose by bacteria. If it's a diabetic patient, glucose is going to be used by the bacteria. So you are going to get less amount of glucose. RBC, WBC, cast. WBC can be lysed. WBCs can be lysed. So even the urine was not red, it can find, you can see the lysed and you can feel the symptoms of hemoglobinuria because when RBC is lysed, the hemoglobin is going to come in the urine. So you can see it can get so many faulty integrations if you doesn't do it in the proper time or if you didn't preserve it properly. So minimum volume of urine analysis is 12 milliliters. No? So minimum volume of routine urine analysis is 12 mLs, okay? But 50 ml is preferable if possible. Smaller volumes may be accepted from oliguric patients or from infants who cannot pee it. Oliguric means very less amount of urine and the infants. Urine can be preserved by refrigeration up to 6 to 8 hours. Just give me a second. Okay. Okay. For the urine analysis, the regular analysis, 12 milliliter is fine, 50 milliliter is preferable to get the actual analytes. And you said smaller volumes, the baby cannot pee 50 ml, so smaller volume, a little bit volume is also accepted. Urine can be preserved by refrigeration 2 degree to 8 degree centigrade up to 6 to 8 hours or chemically using the preservative for the 24 hours collection, right? The maximum time specimen can remain in room temperature is 2 hours after collection. That is very, very important. So just to tell you, I was telling, so these are the things you have to remember. If you keep the urine at room temperature for more than 2 hours, what type of changes may happen? Okay, so these are the questions will come. Obviously 6 to 8 hours, what is the 24 hours urine collection, what is the MSU? So those are common things, but in addition that if the urine is staying for more than 2 hours at room temperature, so it may give you a lot of false results. So what are the false results? Preservation of urine specimen.
Sorry, Miss Mamun.
Yes.
So what? If it kept on the fridge more than 8 hours, like for
Then you have
example,
to
10 or 12 hours, are
then
we
you have
gonna
to use the
discard it?
yes, you are going to discard it until there is preservative there.
Okay.
Preservation of urine specimens. Decomposition urine begins within 30 minutes after collection. So that is the best time frame to do the test is 30 minutes, where you can get the exact analysis, but till 2 hours maximum at room temperature. So this is the questions come. Decomposition of urine begins with 1 hour, 2 hour, 30 minutes. So you have to remember that one too.
Mom, sorry to interrupt you.
Yeah.
Kara says that she needs to have to download again the Teams, and she will be back after
Okay.
19 minutes.
Okay.
Okay, ma'am. Thanks.
Okay. God, where the pen goes. Okay. Preservatives have different roles like to reduce bacterial action or the chemical decomposition. The best method of preservation is immediate refrigeration or preservatives. Immediate refrigeration. If you know that I cannot taste it, immediately refrigerate it. Or preservative. What type of preservatives can be used? Hydrochloric acid, boric acid, and acetic acid. The most common are these. Other preservatives include toluene, formaldehyde, thymol, proprietary additive, and specialized additives if needed for special test. So, collection and preservation of the urine specimen, labeling and processing urine. Label on the side, never on the lid. Obviously, collection date and time, proper preservation, what time you have collected, whether you keep it in the refrigerator or you know there is a preservatives. If there is any, if somebody is asking, patient came for the jaundice test, there may be chance that bilirubin may there. So you have to light protection if test requires it. Quality assessment. Look at the date and time of collection before the running. So you have to check it when you are working in the inside in the specimen receiving, accessing, and in the actual in the lab. What time has been collected? What is the storage? If it is within 30 minutes or 2 hours is fine. If it is not, how it has been stored? It is refrigerated or not? Then if it was refrigerated, bring it to the room temperature. If it is room temperature specimen within the 2 hours, no problem. But before doing the test, you have to well mix, because if there is any sediment, WBC, RBC, CAS, they are going to sediment it down. So you are not going to catch it if you doesn't well mix it. Rejection. Can you think of any reason urine specimen may be rejected in the laboratory?
Yes. Unlabeled,
Yes.
broken containers and
Low
Anything else?
volume.
Wrong identification.
No identification. But so possible reasons for rejection of the urine sample. Incorrect specimen collection or container for test ordered. If they ask you for the culture and sensitivity, if you give the non-sterile container, you have to reject it because it is not collected in the sterile containers. Obviously, insufficient specimen quantity, incorrect preservative, delay in delivery, past maximum date and time at room temperature versus refrigerated one. Unlabeled samples, broken or leaking tube container, insufficient patient information, sample label, patient label on the test, request form do not match. Now you understand everything. You did what is so important. Is any questions there? Do you think anything you cannot understand?
Isn't all
miss, I have a
containers are
question.
sterile?
Yeah, incorrect specimen to collect. Yes, somebody, that's I told you. If they ask for the midstream urine, clean catch urine, you give them the non-sterile container. Non-sterile. For clean catch, you have to give them the sterile container, right?
Yes.
Is it clear?
Yes.
Okay.
I have a question, miss. For the 24 hours collection, right?
Mhm.
When you dispose the first amount of pee, do you have to collect all the rest of the pee for that time?
I don't get to SNet.
Okay, so the first P, like the amount that they said, the first time when you get up, you pee a little
So
bit,
let
and
so
then after you
let let
pee,
let me tell you. For the 24 urine collection, you will
mhm,
start at 7 a.m. 7 a.m. you will go to the washroom, you pee whole amount.
Okay.
Okay, you write the start time. Then probably at 8 a.m. or 9 a.m. when you are peeing, you are going to collect the urine and put it in the big container. Then again, maybe after 2 hours you are peeing, you are going to collect the urine and put it in the container. Don't mix up with the MSU versus 24 hours. 24 hours fast urine, first, whatever your start time, 7 a.m., 9 a.m., 10 a.m., that time you are going to void the totally. Then after that, when you are going to first pee, whether 9 a.m., 10 a.m., 11 a.m., you are going to collect the urine. And that is you void it at 7 a.m. Your first urine has been collected at 8 a.m. or 9 a.m. when you are collect the first urine. And the 24 hours clock is going to go from the same day to the next day, that same time when you start collected the urine, first urine.
Okay, so the first one at 7 you void it.
Yes.
And then the 8 o'clock you start collecting.
Yes.
Okay, I got it. Thank you.
And then you are going around till the next day, 8 a.m. in the morning, what is going to be the end time or finish time.
Okay, thank you. Got
And
it,
you
miss.
cannot miss any of the pee in between that. Okay, so whenever you are peeing, you have to collect the urine and put it in the container, add it in the container.
Okay, thank you, miss.
Okay, no problem. What about urine specimens from invasive collection? A suprapubic urine specimen arrives in the lab unlabeled, but the labels are in outside the pocket of the biohazard bags with the requisition. What should you do?
This disregard, cancel it.
I will
Discard.
cancel it. I will cancel it. I have no
Yeah.
idea. I will cancel it. What DTL will do, because I doesn't know what whose label has been put where, right? So if it is me, I
Discarded,
am going to collect it.
undocumented.
Yeah, I am going to discard and inform the physician. So I don't know how the D2L will say, but for me, I am going to discard it.
Yeah.
Aren't we going to call the physician who took the sample because is it invasive sample? It took a suprapubic. It's a suprapubic urine specimen
Yeah, first you can inform the physician, but
because the
they
label they said the labels are in the outside pocket.
But
So
how I will know that is a specific? I know, I understand that the CSF collection they are. Then you have to
yeah,
call the physician and talk to
yes,
them. They have to come, do the
yeah.
waiver certificate or kind of like that. I don't know what the urine they are going to do that or not. I have no idea about that. I didn't have this one before, so I don't know. For the
This,
CSF collection, yes, we do, because we doesn't take the responsibility. You the call the physician or nurse. They have to come. They have to identify the specimen and they have to sign the waiver certificate that
yeah.
they are the responsible. So
Yes.
I don't know for the urine whether they didn't tell us anything in the urine collection, and I didn't have that experience, so I cannot give you the exact answer. But we'll see what DT will tell. For
Okay.
our knowledge, it is discarded.
Miss,
Yeah.
the CSF, it's harder to collect. So that's why you have to call the physician and let them know. The
Very
urine
collect,
is
and
not,
not only that is a health problem. Sometimes after
yes,
you collect the
exactly.
CSF, there is a chance of nerve injury, there is a back pain,
Mhm.
sometimes the patients can faint. So CSF, yeah, one time they have collected by 9 times puncture in night CSF from me when I have the viral meningitis. I know that what is the painful.
For me, ma'am, for that invasive urine sample, I will also ask the physician to come because it might also go to cytology, like the cells will be for evaluation of any lingering cancer on the urinary bladder. It depends probably on the procedure that will be done on the sample.
Yeah, so they didn't give
Yeah.
any instruction what we should do. So I cannot tell you exactly what is the 100% right, 100% wrong. So in
Yes.
general knowledge, we are discarding, but maybe you can. They didn't tell, right? For the CSF, they told us, right? In the
Yes,
that
ma'am.
you have to do that. They didn't give any instruction unless they give letter. Okay, let us
Right.
see. So urine analysis consists of the following tests. Two parts, macroscopic or physical examination. First, what is for macroscopic or the physical examination, color and clarity is very important. Then we have the chemical examination to see when is coming, when you are doing the dipsticks, what is the different reactions are going on and some color is developing or changing. Then you have the microscopic examination of the sediment. So you are going to centrifuge the urine, then you are going to look at the sediment and urine culture to check whether there are any infection. So physical composition of urine is color, yellow, pale yellow to clear. If you are drinking too much water and it's a random urine, sometimes it's a clear urine. So light yellow or straw yellow is okay. Clarity, it should be transparent. If that is cloudy or is something is floating around, that's not clear. So that is called the clarity or transparency. Urine specific gravity ranges from 1.003 to 1.030. This you have to remember, this is the normal range because it depends upon how much water you has been taken in between and after, how much you dehydrated. So up to this range is acceptable, 1.003 to 1.030. What is specific gravity means? What you measure? Yes, how much analytes or anything has been dissolved in the urine. That is going to give you the specific gravity, the density, how dense it is. What is the physical properties? We have the volume, how much volume is there, what is the color, clarity, if there is any odor, foul smell, or fruity smell, or coffee smell, or some different smell, odor, and specific gravity. That is the physical properties. What are the physical properties? They can give you any one. Specific gravity is a physical, chemical, microscopic. What is the, how we are going to measure the, it is the under the macroscopic. All the physical things are under macroscopic, means you are seeing it by eye. Macroscopic means it's not under the microscope or any, not any chemical reaction. So you are just seeing the urine. You are having this urine. You are documenting all these charts. Volume, this one. Color, light yellow or dark yellow, clear. Clarity is transparent or cloudy or turbid. What is the odor? Unfortunately, you have to smell it. If that is a some odor, what type of? It's a little bit water is okay, the urine, but it's what is the odor and specific gravity. Physical properties of urines, normal range again 600 to 1600 ml per 24 hours. So an average is 1200 to 1500 ml per 24 hours. This is not the range. This is under 24 hours is the normal average, but it can be accepted from 600 to 1600 ml per 24 hours because sometimes you are dehydrated. Sometimes maybe you are having some problem. So this is the range, but the average, this is the range, but the average, generally in general population, how much the urine output in 24 hours is 1200 of 1500 mLs. The total volume of 24 hours urine must be measured when quantitative tests are performed, because that is the 24 hours urine. When it comes in the collection bottle, you have to measure how much has been patient feed within 24 hours. A direct relationship exists between urine volume and water intake, obviously. Pathological states, diabetes mellitus, diabetes insipidus, so they use urine more. Colors of urine. pale yellow or clear, healthy and hydrated. Bright yellow, excess of vitamin B. Red, blood in urine, eating beetroot or blackberries. Orange, dehydration, certain drugs and medications, dietary factors such as eating lots of carrots. Green, drugs containing phenol, some antidepressant, dye in food. Biliverdin is a bile pigment you have learned yesterday, and certain infections. Brown, certain antipsychotic drugs, certain antibiotics. Phenytoin is called the dilatin and sinucide laxative. And purple, polyphidia, a rare metabolic disorder. So seeing the color, only the color of urine, you can understand what type of problem may there. Just only the color. So you see, what color you grade is, what do you think is happening with each of these things? This is normal or abnormal?
That's water, mom. If I will
You see, urine, all are urine.
colorless, colorless.
All are urine.
Yeah, it's a bit. It's no, that's abnormal for me. The light is
Only,
yellow. There will
Yeah.
always be some color.
so that means this is, if we just compare with the color chart,
Yeah. So it
you can
might
see
probably
that is the
it's
vitamin
C,
B,
C or
vitamin,
D.
no, D,
D.
vitamin B, vitamin B. See?
Yes.
Yeah.
Yeah, vitamin B. So
Yeah.
these all are normal, light pale straw color. Then this is the orange color, right? So orange color may be
Dehydration.
anything in the carrot, certain drugs, medication, dehydration. And
Mhm.
red, yeah, red,
Blood
blood,
or
blood or eating beetroot.
beetroot.
Yeah, blood or beetroot.
Yeah.
This is not the brown, right? This is not the brown. This is not the brown. No, this is this color. So it's kind of go to the orange. Yes.
Excluded there, mom, is the color blue.
Blue?
Yes, ma'am. Let's say, for example, the patient is undergone endoscopy, I think. They will inject a dye so that they
Okay.
can see the intestines, digestive system.
The urine comes at blue? I never heard
Yes,
that one.
ma'am. Yeah,
Oh, okay.
yeah,
Okay. Okay.
that's right.
I didn't know
Blue.
that. Oh,
And me
okay.
too. Dark yellow, a really dark yellow. I had the injection of a dye to see
Mm-hmm.
my eyes.
Oh, oh.
Yes, ma'am. Dark, as in dark yellow, like jaundice.
Hmm. What type of yellow? Here, this one, what type of yellow?
Like a jaundice, ma'am. Like high bilirubin, something like that.
Hmm.
Dark, as in dark, dark, dark yellow. Those are even light, ma'am.
Yeah, yeah. So
Yeah.
now we have the color. Now we are going to see the clarity. What is clarity means? How transparent it is. No visible, clear means no visible particular matter is present. That is the clear. Abnormal is hazy, cloudy, turbid, can indicate elevated levels of WBCs, mucus, crystals, bacteria, lipids, spermatozoa, and other artifacts. Spermatozoa can be seen in which urine? Collected from whom?
Males.
Male.
Yes, 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 yes. Oh my God. Let me take a sip a little bit of water. Talking too much. Odor. Normal urine has a characteristic faintly aromatic odor. Abnormal odor, odor of ammonia can indicate breakdown of urea by bacteria. That means it's the old urine. From the odor you can understand that old urine and didn't kept properly. Other abnormal odors can indicate infection, foul smell, infection. Sweet or fruity smell can indicate the ketone bodies. Mainly it happens for the diabetic patient or who is very starvation or extremely strenuous exercise and taking the urine just after that. So ketone bodies. It's a fruity smell. And sweaty, feet, maple syrup, cabbage or hops, mousy, rotting fish, rancid can indicate a specific amino acid disorder for each scent. So what type of smell is that? That means there is a problem with specific amino acid. Foul smell, urinary, I told you, is a UTI. Sweet smell, diabetes. Musty smell, there may be chance of phenylketonuria. That means the ketone bodies. And that has been checked by the kids. You have learned it before, the test for the phenylketonuria. Specific gravity, we told this, is ranges from 1.003 to 1.030. It's easy to remember. Only one, the last three has been came in the middle for the maximum level. Specific gravity is a measure of the concentration of the dissolved substances in a solution compared with the distilled water with a specific gravity of 1 point. Water specific gravity is 1. So in urine, specific gravity is little higher because it has some dissolved substances in the urine. So that makes the urine little bit dense. That is the density. Clinical aspects used for information about two general functions, the state of the kidney and the patient's state of dehydration. If the patient is more dehydrated, urine specific gravity is going to be high because there will be more concentrated constituents in the urine is going to be there. So when the specific gravity increase, dehydration, fever, vomiting, diarrhea, and diabetes mellitus, when there is increase chance of increase in specific gravity, decrease diabetes insipidus and high fluid intake. So physical properties now. Measures of urine solute concentration is called the osmolarity. You can measure osmolality by osmometer. Specific gravity as refractive index by the refractometer. We can measure it in the refractometer. This is the refractometer we have in the lab. You can see how to do that. And using the commercial reagent strip. And we have the urinometer too. I don't know whether we have in the lab. So it's a free floating. Refractometer is an optical handheld device that measures specific gravity. It does so by sampling a small amount of liquid applied to the transfer pipette to the sample's prism and then looking at optically. So you are going to put the sample here. This is the sample window. You can see here sample window, 1 drop of urine, and then you are looking from here, the back, and it's going to give you this type of things. One blue and that one. Where is the card value? That is your specific gravity. Need to calibrate it before use with distilled water. Always do with distilled water so that it's calibrated and the instrument is working, is giving the specific gravity 1. Take the reading. The refractometer compares the gravity of the urine with that of distilled water. The light is bent through a prism and the optical density is measured on a scale designed with the urine specific gravity. The scale increases. That means it is going to give the high reading with the urine, concentrated urine. Clean refractometer prism after each use with distilled water. These are the different types of refractometers. So you are going to do it, put it here, the water first. Then you are going to see it should give the specific activity here. 1. Then when you are going to put the urine, it's going to give you the specific activity. It should be between 1.003 to in between maximum this one 1.00. If it is more than that, that means urine is more concentrated. This is the calibrated refractometer scales with the water. Then we have osmometer. What is the osmometer does? Urine specimen also. This is also you can do it and put it in the osmometer is going to give you the reading. And then you have the dipstick. So here dipstick you can give this one and you can see it's going to give you the measurement here with the dipstick. Urine specimen storage. After testing, urines are stored in the fridge based on the date of testing. Not freezer, fridge. Urines are typically kept for 1 week. This may differ by lab to lab. More invasive specimen may be kept longer, like the suprapubic aspiration or some who is very difficult in getting the catheter on the baby is very difficult. So that time it depends upon the symptoms and the required if they need to be tested for sometimes. 24-hour urine containers are emptied and thrown out after urine aliquots are poured off for testings. 24-hour urine, you are not going to save it anyway. Disposed of biohazard waste containers. What question?
Yes. So we as technicians, what's our role exactly? Do we do the macroscopic examination, or
Yes?
is technologist
No,
role?
you have to do the physical properties, chemical properties. Yes, you do the urine analysis, not the microscopic. You make the sample preparation for the microscopic examination. Make the slide. That is the microscopic, what you are going to learn later. But you are going to do the physical color, all the urine analysis, dipsticks, refractometer, everything you can do, and technologist is going to sign it.
Okay. So this is for macro. We're going to do micro as well.
Micro, you are going to prepare the sample. You are not going to look it under the
Okay.
microscope.
Okay.
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 Anything? Let us see what is the next one. I saw something up. I told you guys we are going to go later. Where is that on live lab? So they told you to go to the live lab side. What is that one? Okay, so it said live lab runs a creatinine level on all 24-hour urine specimen to assess completeness of the collection. So as a group, go to the live labs, test and services website and look for some 24-hour urine test to fill in this table. So this is your job. Okay, so you can work on that. Okay, and what is the next one? So you are ready for the test. I'm going to go to the 5 after that. So you can go and break. Okay, so you can come back at 11, and then we are going to, what is the unit 5? Let me see what is in the unit 5. Microscopic urine analysis testing. Okay, so that we are going to do that. How many slides are 21? Not too much. So we are going to do that one. And what is next? That is the video. Okay. Microscopic. Then unit 6, body fluid PowerPoint. Unit 6. Unit 6, Unit 6, Unit 6, Unit 6. Unit 7. Assignment preparation. Okay, so that is the assignment preparation. Unit 6. Okay, Unit 6. So we can learn unit 4 is your test. Okay, so unit 5, microscopic. This is we are going to learn today, microscopic analysis testing. So we are going to done. Then I will give you some time to do your what is called work. All these things, whatever is here, there, project. So you can. I will give you time. Tomorrow we can learn unit 6, or if you learn the unit 6 tomorrow, then unit 7 you are free for your presentation and other things on Friday. Or if you want time tomorrow, so tomorrow you can do all your projects and this and that, and then on Friday you have to learn the unit 7. What do you want?
Yes, ma'am. I think that's doable, ma'am.
What?
We're submit we're submitting our assignment tomorrow, right?
You want
The
to do
group
what? And
assignment.
you're not going to learn unit 7, mm, unit 7 on Friday? Unit 6 on
Yes,
Friday?
ma'am. Yeah.
Okay.
Because
Okay.
we have the exam on Thursday from
Okay.
unit 1 to 3.
Yes.
Yeah.
Okay. So go for break, come back, then we are going to do the unit, what is called unit 4.
5. Of course.
5, 5, 5, not 4, 5.
Yeah.
Okay.
Okay, ma'am. Thank you. See you at 11.
Okay. Okay. 11:05.
Thank
Yeah.
you. See
Thank you,
you.
Miss.
Okay. Yes, Venus joined the team. And who left? Maris?
No, I'm here, Mom.
So who is not here? Alexia, Amina, Seneth, Kara. Kara,
Yes, ma'am.
still
I'm
she's
here.
feeling. You are
Oh,
here?
it's already
Who
here.
is up? Junaida,
I'm
who's
here.
flying? No, Bharna, Sabana, Santiago, Rugiato, Maris, Luis, Kara, Joanna, Christiana. Who is not here then? Because I saw 20 people. There should be 21. Let me call the name. Huda? 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 She is not there. Yeah, Huda is not there. I didn't see Huda. Huda was here in the morning. I didn't see her. Hmm.
Miss,
Yes, please.
there was 21 people this morning.
Who?
There was 21 of us online
Yeah, but
today.
right now I don't see her. So she didn't send
Okay.
any information. Like Joanna sent me an information, she is sick. Mary sent me an information, maybe she is going to like that. People has to communicate with me. Otherwise, having to who is coming, who is leaving at what time, when during the lecture. I
Yeah.
don't see any message, right? They have to inform me. What time she left, I don't know. Just immediately she left or after sometimes. Okay, so now we are going to we learned about the macroscopic examination. Now we are going to the microscopic. Microscopic means it is going to seen under the
Ma'am,
micro. Yes.
Huda is here.
Hi, Miss. Sorry, I had to join from my phone. My computer's acting up right now.
Okay.
Hello, can you hear me?
Yes. We can. You can hear us? You can
I
hear
can hear
us?
you, yes.
Okay.
Yeah.
Okay. Okay. So we are going to learn about the microscopic analysis of the urine. Therefore, which has the sediments? When you centrifuge down, microscopic means you have to see under the microscope. What is that? All solid materials. We can see that which is the dissolved material, you cannot see under the microscope. That you have to see by the macroscopic analysis, the chemical analysis. But which are not suspended in the urine, which is floating, is not suspended, is giving mixed with the urine, only those things you can see under the microscope. That is called the urine sediment. So all solid materials which is suspended in the urine can be measured through the or analyzed through the microscope. Microscopy examination of urine is helpful in assessing the presence of kidney and urinary tract diseases. Not all urines require a microscopic analysis depending upon the symptoms. Specimen requirement, freshly voided collection is acceptable, but the ideal specimen is first morning urine, that is the 8-hour concentrated urine, because it is most concentrated, and if there is anything, even traceable amount, it can be detected. Preservation. If the urine cannot be examined once again within 2 hours, it should be refrigerated or chemical preservative might be considered depending upon the test ordered. Refrigeration can precipitate amorphous crystal which can obscure the urine. There is some, if there is crystal or something, when it go to the refrigerator, is going to be sedimented down. Protection from contamination. Urine should be clean and free of external contamination, especially with the female patients, so that there will be no cross contamination. Normal urine has minimal to no sediment clarity is clear. It can be seen normal to see trace of RBCs, trace of WBCs, trace of hyaline cast, few epithelial cells, spermatozoa. This is natural. You can see not lot. If there's a lot of WBCs, there is a chance of infection. So very trace amount or not detectable amount or may not be present. These things you can see it. Microscopic reading is done by the medical laboratory technology. So you are going to prepare the sample, put in the slide, and then MLT is going to do the analysis, or I don't know why nowadays auto analyzer does that or not. Testing principle. Microscopic elements present in urine is in suspension. That is, it's not going to mix with the solution. It's not dissolved in the solution. So it's suspension, are spun down and concentrated. Then the sediment is mixed well with the remaining urine. A small drop of the sediment is putting on the slide, covered with the cover slip or the mount on the slide, and can be seen by the medical lab technologist. So testing supply requirements, what you need? You need the freshly voided urine if possible, or best is the first morning urine or 8 hours urines, concentrated urines. You need a conical centrifuge, that is the 12 ml. You need a glass slide, you need cover slip, you need pass-through pipette, you need centrifuge and microscope. So first, you get the urine in the primary collection. Say, for example, you collected in the bottle. Okay, so from the primary collection, before you taking it, because you cannot, you always have to give the patient a bottle to collect the urine, because nobody can collect the urine in this conical tube. So you have to give the bottle either sterile or non-sterile depending upon what the test has been ordered. So you are going to give a bottle, the patient is going to deliver you urine in the bottle. Then it's going to stay there, right? And before testing, what is your job? You have to mix it. If something is suspended, if it's settled down or anything, you have to mix it. Then after mixing, what you are going to do, you are going to pour from the primary container to the conical tube. That is the centrifuge tube. This conical tube is centrifuge tube. So how much you want to take in the conical tube? Sorry, 10 to 15 ml. If quantity is less than 10, you have to document it, because that is not sufficient quantity. But in case of kit sample or sample with this problem in urination or kachra, so who doesn't pee too much, so that time if you get less than 10 ml, you have to document it, because the physician can check along with the document symptoms, results, and the patient condition. Okay, too little volume, fewer from animals, because less volume, less amount. Then centrifuge with another ballast test tube. As you know, for any centrifuge, you always need a ballast tube, right? So you have to use another ballast tube with the same volume, and then you weigh it. Okay, and then you have to centrifuge another balance test to 5 minutes. 5 minutes. The total time is 5 minutes. Oh my God. A relative centrifugal force of RCFs of 400 is ideal. We do at 10,000, 10 to the power minus radius in centimeters RPM. So you have to cap all specimen nicely, tightly. You have to put in the opposite things after weighing, balancing, and then you are going to centrifuge with 5 minutes, generally 10,000 RPM. Then what you are going to do, you are going to decant the supernatant using a transfer pipette, not just pouring. You are aspirating out from the top of the urine. Say you take the 10 ml or 12 ml, You have to aspirate out, not disturbing the bottom of the precipitated. If it is 12 ml, you have to take it out 11 ml. What you are going to leave there? Only 1 ml at the bottom, where you have the all suspended materials as a precipitate. So it said it's usually 12 ml of urine produce 1 ml of sediment. So 12 is to 1. So that means you are going to take 11 ml out. Only 1 ml is going to be there in the bottom of the tube. Mix sediment gently, not vigorously. Gently by tapping, not by vortex, because there is cast or something or the blood cells is there, it may break down. So mix sediment gently, not vigorously. Place 1 drop of deposits on a glass side with a pipette. Glass side method is you have to put 20 microliter, then you have to cover it 22 by 22 glass cover slip. Do not overflow cover slip. If the urine, if you put too much sample and the cover slip is flooded with the urine, then it's going to be problem in visualizing under the microscope, because the heavier elements flow outside. So you have to very gently put the cover slip. Cover it with the cover slip, mark it with the identification number in the slide on the side, and submit to the MLT for interpretation. No bubbles, do not overfill. There should be no bubbles, you don't be overfill that so that the cover slip is floating on the slide. Elements must be evenly distributed throughout the slide. If not, you might be asked to prepare another wet prep. So mix well. So microscopic analysis of the urine sediment, 12:1 ratio, scientific 12 ml of urine, decant the urine, so up to 11 ml, resuspend the sediment with the 1 ml urine volume, what is the rest? And then you are going to, what you are going to do, you are going to drop it, 1 drop, you are going to take it. You can do the OVA system. Oh, they have a different system, and then they can do the serial dilution or some dye they are putting. I don't know. This is generally does with the okay. They use the pastille pipette and then put some dye in there to color it, and then they take out sample from there, put on the slides, then put the cover slip, and then see under the microscope. Reference values of urine sediment, red blood cells 0 to 2 per high power field, that means almost nil. White blood cells 0 to 5 per high power field, cast also 0 to 2, squamous epithelial cells few in low power field, transitional epithelial cells. So these are can be seen, except you will not see any bacteria, you are not going to see any yeast, abnormal crystals, and if the urine is normal, no problem. Sometimes in sperms can be seen in the male because they have the single opening area. So elements that MLTs identify in the field of view of the microscope. Squamous epithelial cells looks like this, RBC looks like red, RBC cast a little bit harder, WBC, WBC cast when they are forming like this, clumping together. Yeast, they have like these growth buds, granular cast when the cast with the granules, if it's a spermatozoa, different type cast. You doesn't need to know all these things, but uric acid crystals, calcium oxide crystals, each has different shapes, size. So what are the other cell constituents? Yes, known the spermatozoa, bacteria, yeast, and parasites. Which parasites can? Mostly Trichomonas vaginalis, which stays in the vagina. And some tumor cells can be seen also. Specimen changes on standing. RBC deterioration, WBC disintegration, cast disintegration, components of acid urine disappear as urine become more alkaline, that we have learned due to the use of the bacteria, and bacteria multiply rapidly using the glucose. Automation analyzer, urine analyzer, automated urine analyzers aids in the precise and accurate urine results while reducing turnaround time and workload of the laboratory. So you can just put lot of samples at the there and you can run the analyzer and it is going to give you the results.
Working with Adobe Acrobat AI Assistant, I'm creating a business of acting manual to help others. A manual of this size would take me.
Remove the dust cover from the microscope. Clean the lenses as necessary with clean, dry lens tissue. Do not use ordinary facial tissues on the lenses. These can scratch the soft surface of the glass. Use lens tissue as necessary to remove dust from the light source. Avoid touching any lens or mirror with your fingers. Sanitize your hands and put on disposable gloves. You will need a urine or centrifuge tube with a pointed end so that solid material would be concentrated in a small area. Write the patient's name and the date on the tube with felt tip marker. Open the urine specimen and pour some of the well-mixed urine into a centrifuge tube or urine tube. Fill the other urine tube in the same level with water and place a cap on each tube. Place the urine tubes directly opposite to each other in the urine centrifuge. This
That
will
is been
balance
filled
the
with the
centrifuge.
same volume. You can see water.
Close the lid of the centrifuge and set the timer for 5 minutes. Turn it on. It will start and stop automatically. Turn on the power switch of the microscope light source and make sure the microscope low power objective, the shortest one, is in place. When the centrifuge has stopped, open the cover, remove the urine test tube without shaking it. Remember to be careful not to shake the test tube during this part of the procedure, since you will be drawing a sample of the separated sediment at the bottom. Push the urine pipette into the tube as far as it will go and pour off the urine above the wide part of the pipette. You may also use a transfer pipette to suction off the liquid above the sediment, the supernatant fluid, and discard it until there is about 1 milliliter left in the bottom of the tube. Mix the sediment with the remaining urine by suctioning up and down with the transfer pipette. Note that a sink used to discard urine is considered dirty and should not be used for hand washing. Place a microscope slide on the paper towel and prepare a cover slip. Dispense 1 drop of the mixed urine sediment onto the center of the slide using the pipette. Pick up the cover slip, touch one edge to the urine drop, and carefully lower it over the drop so there are no air bubbles under it. Place the slide between the spring clamps of the microscope slide holder so that the center of the specimen is positioned over the opening in the stage. Make sure the light source is on and the condenser is lowered with the diaphragm closed. Focus the low power objective using the coarse adjustment knob and then the fine adjustment knob. Inform the physician that the specimen is ready for viewing. After the physician has looked at the slide, remove the slide and discard it in a rigid biohazard sharps container. It could pose a cutting hazard. Clean the enameled surfaces of the microscope as necessary with soap and water. Wipe the stage with gauze or tissue. Be sure the low power objective is in place. Clean the lens with lens paper. Put the dust cover on the microscope and return it to storage.
This $36 gadget cleans any bathroom in 5 minutes. It's a new handheld.
So we are going to learn this on Friday, right? That we have decided?
Yes.
Okay, so tomorrow, so you guys can start working on your everything, and there is that one also in the unit number 3. There is some due for your, what is that one? That go to the live labs and go to the see the 24-hour urine things that you have to do that too. This one, okay? The group who is working, they are going to group to the live labs, test and services, and then fill up this one. I think this is the slide number 12 out of 39. Types of urine specimen, unit 3 under types of urine specimen PowerPoint. Okay. Anything else you would like to know?
And you will have access for this, ma'am, in D2L?
You can check. It should be.
No, for you, ma'am. Yeah.
You can. How you are going to submit it? I don't know.
Exactly.
That is not written in the assignment. Let me see what the assignment are. Clinical chemistry, urine analysis, urine assignment. Assignment is already there. 2 assignments, right? Which due date I should give it to you guys? Tomorrow? 12?
Mom, you said, yeah, 12 Wednesday for the MS Word.
Yes. And the PowerPoint, you are going to bring it, send it to the email to
On
present it there.
Monday.
Yeah, Monday.
Yes,
I have to,
ma'am.
yeah. So I'm going to put tomorrow, okay? 12?
Okay, ma'am.
Okay.
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 Okay, ma'am, tomorrow.
Mm-hmm. You have a lot of time now. Save and close. Okay. Okay, nobody will leave. You guys are going to work on your project. Okay. So I'm stop sharing now. So you guys can make your own group and work from there. And I will try to work if I can, some review and will send it to you. If I can.
Thank you, ma'am.
Thank you,
Thank
ma'am.
you. Thank you,
As
Okay.
ma'am.
always.
Okay.
Thank you, miss.
Okay. No problem. Let me complete the attendance now. Attendance. It's the urine analysis, body fluid. Day 2. Attendance. Urine body fluids. Day 2.
Hello?
Yes.
Hello?
Yes. Are you speaking to me, Asnet? Asnet?
Sorry, miss. No, it's not.
Huh?
No, miss, it's not you. Sorry.
Okay. Okay. Save. Mm-hmm. No, no, no. It's 5 students per group. One person can submit it, but in your project you have to write the name of the 5%. Yeah. So yeah. So you can write in that who for group 1 how many are there. Okay. 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 No, don't 5 people send me the same project. No, only one. Yeah. 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 But probably yeah. Yeah. And send me in the D12 also. Yeah. 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 Okay.
Thank you. I was going to ask the same question. Good question, Louis. Thank you, Miss.
Yeah. You can.
So it's not the 5 people who are presenting it, only one? Is that what you're saying?
One submission, as in it.
Yeah,
One
only one.
submission?
Yeah.
Okay.
It's all
So 5
included, all the
people
names.
working in one project. So it's going to the
Okay.
same project. What is the
Yeah.
use of 5 people are sending the same project? It's more
No, no,
confusing.
no.
Yeah. So
No,
that's why send one, but put everyone's name there.
Yes,
got it.
ma'am. And we can submit it in Word format, ma'am, but the presentation will be in PowerPoint. Is that correct?
Yes, Evelyn.
We send it
Presentation will be
both,
in slides.
the MS Word and the PowerPoint.
Yeah.
Okay.
Yeah.
Thank you.
Goodbye, everyone. See you tomorrow.
Yeah, bye. See you
Take care.
tomorrow.
Bye. See you tomorrow.
Bye. See you tomorrow.
Bye. See you tomorrow.